Lymphocytic colitis. What's the difference between colitis, ulcerative colitis, and lymphocytic colitis? We're going to focus on lymphocytic. So this, what does lymphocytic mean? Lymphatic, the lymphatic system, lymphatic cells, which are the white blood cells, the so-called deemed immune cells. Why are there so many immune cells inside of your colon right now? So a German doctor discovered exactly what is going on inside of you right now. He could see it in your brain. Everybody who had colitis, he could look at their brain CT scan and go, oh, right there, okay, yep, that person has colitis. So it's actually caused by a conflict shock, which is a stressful event that catches you off guard. It's usually like crap I can't get rid of if it's colitis. And now your brain's going to go, hey, put the colon into overdrive, and it's going to develop extra cells. What are you talking about? Go look at your labs, your colonoscopy report. You'll see a polyp or thickening of the intestines. The thickening of the intestines, it's a flat growth, and it helps with absorption. And the cauliflower growths, the polyps, they help with breaking the crap down. They create extra digestive juices. Now, and look, this is not stuff you're going to hear from your GI doctor, because your GI doctor is not obligated to learn this at all. All he wants to do is just keep you on drugs and so he can keep the payroll going. They legally can't look into this stuff. It's insane. It makes no sense. So those cells develop during the conflict act. I want to get rid of this crap, but I can't. All right, I'll help you out. Then when the conflict gets resolved, that's when the white blood cells come in. That's when the E. coli come. E. coli comes out of your own cells. They've seen it under a microscope, and they start to break down that tissue, and that's when you start to see blood in the stool, because we're removing physical flesh from the body. So I don't know what possesses a GI doctor to call it lymphatic colitis and not just colitis by itself. I like to use the terms as like colitis, it's inflamed. Ulcerative colitis, it's inflamed and bleeding. Diverticulitis, it's inflamed and there's pockets. So you can reverse these colitis symptoms, but you have to get to the conflict and come to peace with that conflict on a conscious and subconscious level. I help people do that with my program, but yeah, I've fixed it. I had colitis, I had Crohn's, I've tried diets, I've tried drugs, and until I started following this thing called German New Medicine or Germanic healing knowledge, that's when I started to get better. That's when I started to eat whatever I wanted. I eat whatever I want. I eat gluten, I eat dairy, candy, soda. I try to eat healthy. I eat whatever I want. I don't think about it. I don't have fatigue anymore. I have formed stools. No gut pain. I am fine, and I've helped many people do this when drugs didn't work. I've helped people who are like literally 3 days from getting the stoma, having a stoma, and having all that mess. It's where they cut out your colon. You have to wear a bag of poop for the rest of your life. I've helped people fix that. But you have to get to the root cause.